Good evening, I'm Jeff Glor. She was wearing protective gear. She still got Ebola. Tonight, new questions for the hospital in Texas that is now dealing with its second case of the virus, and a new search for those who may have been exposed. The latest person to come down with Ebola is a nurse who cared for Thomas Eric Duncan. That nurse was wearing a mask, gloves, and gown. President Obama is calling for an investigation into what went wrong as hospital workers across the country now wonder if they're prepared. We have two reports, beginning with Vicente Arenas.
The CDC says the nurse cared for Duncan on multiple occasions while he was in isolation. According to protocol, she had been monitoring herself for symptoms. Friday night, she detected a fever. The hospital admitted and isolated her within 90 minutes. CDC Director Tom Frieden said today it's very concerning that a worker who seemingly did everything right got infected.
We don't know what occurred in the care of the index patient, the original patient in Dallas, but at some point there was a breach in protocol, and that breach in protocol resulted in this infection.
Frieden said it's possible the nurse was exposed when she was taking off her protective gear. She also could have been infected while assisting during high-risk procedures. CBS Chief Medical Correspondent Dr. John LaPook.
We know that Mr. Duncan got dialysis. He also got a breathing tube inserted into his lungs. And those are procedures in which there is a danger of contamination of healthcare workers.
Starting today, the CDC is reevaluating the protocols for using protective gear and limiting the number of healthcare workers who treat an Ebola patient. The agency will also rethink how many more people need to be monitored for the next 21 days. Already one person who had close contact with the nurse has been isolated, as well as her pet. Early this morning, police quarantined the nurse's condo. Flyers were handed out, and a reverse 911 call was made to neighbors within a 4-block radius of her home.
Please be advised that a healthcare worker who lives in your area has tested positive for the Ebola virus. Precautions are already in place to clean all known potential areas of contact to ensure public health.
Sean, who asked us not to use his last name, lives a few doors down from the nurse.
When you were given the flyer, what went through your mind?
Thought it was a joke.
Jeff, in the wake of this latest infection, the CDC says that every hospital must be prepared to take Ebola patients. The CDC says that it would also be prudent for those Ebola patients only to go to hospitals specifically designed to deal with the virus.
Vicente, thank you very much.